of State Administration for Market Regulation, and they will give us a update on prevention and control against the virus in winter, and also the Patriotic Public Health Campaign. May I first give the floor to Mr. Li Bin. Dear friends from the media, good afternoon. The CPC Central Committee and the State Council attach great importance to epidemic control in winter and also to the regulation on food and also on sanitation. On multiple occasions, the State Council and CPC Central Committee have made important guidelines, and the Vice Premier Sun Chunlan has, on many different occasions, made specific deployments. On October 23rd, important guidelines was made to guard against epidemic imported in from foreign countries. And another standing committee meeting of the State Council called to faithfully carry out the policies of the CPC Central Committee and to do a good job in preventing the disease from being imported to China. First, with respect to epidemic control in winter, recently the National Health Commission has worked together with other relevant departments to step up prevention of virus in winter. We will publish the number 7 edition of the National Treatment Protocol against coronavirus. We will also step up our publicity efforts and guide relevant localities in their specific efforts. Second, we will summarize experiences from our fight in Wuhan, Beijing, Jilin, Dalian, and Urumqi. In so doing, we have formulated the emergency handling guideline against COVID-19. We also drafted a practical guideline on epidemic control. We've dispatched relevant expert teams in guiding epidemic control, and in the meantime, we have supported the epidemic control in Urumqi, in Tianjin, in Shanghai in terms of epidemiological studies. Third, we will do a better job in prevention of the virus from overseas, and we have formulated the cold chain food regulation guidebook. In so doing, we have comprehensively improved our technical guidance on the regulation of food and other relevant risks. We have organized experts to study the situation. Number 4, we have increased our capacity in epidemic control in winter. We formulated a national expert team, carried out drills and exercises. We guided the localities to step up their capacity in NAT. We also formulated technical documents on mixed texting of NAT. In the meantime, we have organized some trainings. And number 5, the Joint Prevention and Control Mechanism has carried out a nationwide inspection. And the prevention work in winter is one key part of this national inspection. In so doing, we aim at close the loopholes, and we require the different localities to step up their efforts and to carry out relevant measures. Number 6, to carry out patriotic public health campaigns, and this can be reflected in 3 areas. Number 1, we have stepped up top-level design, and we have formulated a opinion on epidemic control, and the opinion will be released in a short term. And this opinion has summarized relevant experiences and some specific practices in epidemic control, and this is a results and question-oriented guideline which specified the key tasks of epidemic control going forward. Second, we have improved our mechanism and we established the rules of procedures for the work of the National Health Commission. And for the second half of this year, the key tasks were outlined. We also specified the responsibilities and tasks of different localities and departments. And number three, we have given specific guidelines on some infectious diseases, for example, infectious flu and also COVID-19. And the notice was circulated on November the 10th, aiming at cultivating the habit of sanitation and strengthening prevention against infectious diseases, and carry out patriotic public health campaigns in winter. We have organized experts to study the potential situation of epidemic control in winter. The experts are of the view that at a time when the pandemic is still raging the whole world, China faces increasing risk in keeping off the virus, and in winter we expect some scattered cases and some cluster infections in some regions. In the meantime, in winter, other respiratory diseases will be on the rise, and we cannot slacken our efforts going forward. The National Health Commission will work with relevant departments to engage in the following 6 areas of effort. First, joint prevention and control, relying on the efforts of the public. We will strengthen information sharing and step up the responsibilities of different localities and hold relevant authorities accountable. Number 2, improve early warning and do a better job in NAT and track 8 major categories of people, and all the relevant cases will be put into treatment, and we will focus particularly on workers in the cold food chain industry and also health institutions, food and vegetable markets, and other relevant workplaces, so that we could have early reporting, early warning, and early treatment. Number 3, we're going to increase and improve our reporting mechanism by working together with relevant departments. We're going to cover all the inbound travelers in terms of NAT, and we're also going to step up the inspection and quarantine of food imported from overseas countries. We will also increase and improve the self-protection of relevant personnel. Number 4, improve key links, and this includes schools, kindergartens, nursery homes, food markets, agriculture, wholesale markets. We will improve our relevant measures, and we will also educate the public to develop the habit of wearing masks, washing hands, and also keeping social distancing. Number 5, we're going to improve our emergency treatment protocols, and preparedness will be improved. Where there is a cluster infection, immediate actions will be taken place. And number 6, we are going to improve our joint prevention against infectious flu. In the meantime, we are going to improve the warning system on respiratory diseases. By putting in place such a mechanism, we are going to have early identification of potential diseases. In so doing, we can also dramatically reduce the risk of overlapping harms of infectious flu and COVID-19. And our efforts will cover the whole process of early reporting, warning, and treatment. Thank you very much. Now let's give the floor to Mr. Luo Zhaohui. Thank you very much, moderator. Dear friends from the media, good afternoon. It's a great pleasure coming to today's press release. and report to you what we have at our hands. When we talk about the international situation, we always talk about uncertainty, which is a buzzword, and there is growing uncertainties in terms of international situation, and we have changes unseen in 100 years, and the diplomatic relations between China and the United States have also changed. Despite all these challenges, under the leadership of President Xi Jinping as the core of the CPC Central Committee, this nation has secured a victory in a battle against COVID-19 and also in the development of our economy. And this is truly amazing. And we have become the first country amidst the pandemic that has achieved positive growth of our economy. You have also read relevant reports. And yesterday, the CIIE, which was concluded only yesterday, was a great success. So all these are examples of China's success in the fight against the coronavirus pandemic. We always say that there are global issues, unconventional issues, and multinational issues, and those issues have to be solved by countries working together. Only when we cooperate and have each other on our mind can we jointly solve the issues and address the drastic changes unseen in 100 years. For China's diplomatic efforts under the leadership of President Xi Jinping and led by State Councilor and Foreign Minister Wang Yi, it is fair to say that China's diplomatic efforts have made important progress. Since the beginning of this year, President Xi Jinping has made a lot of contacts through video, telephone, and other cloud channels. He engaged in more than 90 diplomatic tasks, bilateral or multilateral. President Xi Jinping has expressed the sincere wishes of the Chinese people in friendly cooperations with other countries, and these diplomatic efforts have pointed a clear path forward for the global efforts fighting COVID-19. And Premier Li Keqiang also engaged in more than 30 online and offline diplomatic events. And just now, Premier Li Keqiang was having an annual 10+1 China-ASEAN Leaders Summit. A wide range of consensus were reached, and State Councilor and Foreign Minister Wang Yi has engaged in both online and offline communications with his foreign counterparts. He made telephones, wrote letters, and he has been in more than 170 diplomatic events. So all this tell the fact that the Chinese government put people in the first place, and we unite people of all ethnic groups in the fight against COVID-19, and we are contributing the Chinese solution and Chinese strengths to the global fight against the pandemic. And in terms of international assistance in the application of the vaccines, we have expressed our proposals, which are well responded by relevant countries. And according to our statistics, we have provided donations or assistance to 150 countries and 7 international organizations through business channels. We have also provided a lot of medical supplies to a huge number of countries, which played a very important role. And just now in the China-ASEAN 10+1 summit, countries give high appraisal to China's efforts in this regard. In the meantime, they have explicitly expressed their intention of furthering their cooperation with China in vaccine development and application. China's leader, Premier Li Keqiang, also thanked the support and cooperation from ASEAN countries during the pandemic. The Ministry of Foreign Affairs has also coordinated and organized some efforts and has coordinated epidemic control and economic development. We have established fast channels of people-to-people exchanges and also built the green channel for the exchange of medical supplies and also for the life channel of crops and grain supply. All of these efforts have stabilized the global supply chain and played a very important role in recovering economic and people-to-people exchanges. We also helped our embassies and supported border provinces in China to step up joint prevention and control with their neighboring countries. Since the outbreak of the pandemic, the State Council and the CPC Central Committee have attached great importance to the livelihood and life safety of overseas Chinese. We always have them in our heart. The Ministry of Foreign Affairs has been working closely together with more than 200 embassies, and we are closely tracking the physical conditions of millions of overseas Chinese. Our efforts have covered a very long duration and a huge number of people, which is unprecedented since the founding of People's Republic of China, and up until present, we have 157 embassies and consulates in 92 countries, which have donated more than 1 million sets of medical packages or health kits. We have also provided a lot of support for international organizations. We are also working closely together with relevant governments and to encourage them to pay more attention to the security and life safety of overseas Chinese, and also to provide necessary support to people in need through pairing mechanisms and with the support of renowned experts here domestically. We provided a lot of support to overseas Chinese who are in need of medical support, and as of 2 days ago, we established interim flights, and we changed some of the civil flights into cargo flights, and we changed some of the cargo flights into civilian flights, and we have brought back more than 70,000 overseas Chinese. We also ensured the smooth connection of the 12804, which is the hotline, and the total incoming calls registered at 3 times more than the same period last year. In every 3 minutes, there is a incoming call. Sorry, in every minute there was 3 incoming calls. So no matter where you are as a over Chinese, your motherland stands strong behind you. At present, the coronavirus is taking a strong second swipe, and we have seen the latest updates of the cases, which has exceeded more than 52 million, and a lot of the continents have registered more than 10 million cases. So on a single day recently, there are more than 600,000 cases, and in the United States, over the past week, each and every day, they have 100,000 more new cases. And in Europe, they have registered more than half of the new cases. And in India, they have roughly 8.5 million cases. And in Russia, 1.8 million cases in Indonesia and Bangladesh, and they have altogether more than 400,000 cases. So I think the second wave is a very daunting challenge and a stark reality. As of present, we have altogether 3,600 cases imported from overseas, and the speed has been accelerated since October. And on an average day, we have 16 imported cases, and this is 50% more than October. And in the first few days of November, we have 260 imported cases. As Li Bin has mentioned, that we do not just face challenges from overseas, and we also face a potential swipe here domestically, and facing challenges both inside and outside. We have to do a very good job in winter in terms of epidemic control. So this is a very important task of the Chinese government in terms of epidemic control, and we can never slacken our efforts, and we are not in a position to be complacent, and we have to further leverage our successful experiences, mobilize the whole country, and secure the final victory in fighting the pandemic. In so doing, we can protect the health and life safety of each and every citizen. So this has actually always been the center of the task of the Chinese government, no matter you are Chinese citizens or Chinese citizens overseas or students overseas. So this is equally important. And as we have mentioned, that this coronavirus pandemic has claimed more than 1.9 million lives worldwide. And since the outbreak, Chinese government has practiced stringent measures of lockdowns, and we put people's life in the first place. Now, in retrospect, it's unimaginable how much worse the situation could be had we not taken those measures. As Li Bin has mentioned, each time there is a cluster infection, we put our wholehearted efforts in it, and we mobilize resources and strengths from all over the country. At the worst time of the global pandemic, governments across the globe have strengthened their efforts in epidemic control. That was a time when cross-border travels were put into restriction, and we do have a lot of people who need to travel to China, and we welcome such travels. But at a time when the pandemic is still ravaging the whole world, this kind of cross-border travel will inevitably be affected by the new restriction measures. It not happens here in China, but also happens in other countries. So there is no exception in this aspect. So that is why the WHO encouraged all of us from the very beginning to pay close attention to this very important issue, and we have followed the regulations and advices of the WHO to encourage the public to reduce international travels and cross-border trips. We did so to reduce the risks of infection, and our measures taken have effectively helped a lot of the passengers and travelers to carefully study the situation and to protect their life safety. And we do so to encourage early identification of the virus and also early treatment. So this is of crucial importance to the travelers themselves, to China as the country, and also to the whole world. So this is the contribution that you can make to the whole world. All in all, we aim at protecting people's health and life safety and consolidating the results of our fight against COVID-19. Recently, the Chinese government has published some new measures in fighting COVID-19. As I have just mentioned, many countries lifted the lockdown despite the pandemic. A lot of the countries have come back to this lockdown. So under the new circumstances, we have to take into consideration the new reality, and we have taken some new measures, and I think you are very familiar with those measures. For example, we have added one antibody test. The NAT measure, which was put into place since July, reduced from 72 hours to 48 hours, which means that you have to conduct a NAT within 48 hours before you board on the airplane. So we have the requirement of due negative results for both the NAT and antibody test. And for countries with high risks of infection, we have to tighten the visa policy, and in the meantime, we are tightening our regulation on international flights flying to and from those countries. With the development of the situation, we are keeping pace with our measures, and this is dynamic. This will not be rigid and static measures. And if you have noticed that in the end of March, when the pandemic was at the most dangerous moment, on March the 2nd, we released a notice to adjust the arrangement of international flights, to tighten our policies in visa. And half a year later, in the end of September, the situation in Asia and in Europe picked up, and that is why we issued another notice. We relaxed our policies in visa application and also relaxed our regulations on international flights. So those measures were taken in accordance with the changing situation. But right now, the second swipe is taking place, and we have to tighten our policies again. What I'm trying to express here is that the new measures are dynamic measures which are subject to the changing situations, and they might be further relaxed or further tightened, hinging on the changing situation, and we do so to fundamentally guarantee the health and life safety of each and every one of us, and we do so to consolidate the hard-won results of the fight against COVID-19 and also to consolidate the overall landscape of our economic recovery. To win the battle in this upcoming winter, the Chinese government has every confidence the pandemic is a common challenge facing all mankind. No country can be isolated from this. We will uphold the concept that mankind are living in a community of shared future, and we are going to stick to the principles of cooperation and coordination and follow the guidance of science. So each and every measure that we have taken are a result of science-based consultation by multiple departments of the Chinese government, for example, the National Health Commission of China. And those experts and government officials, they consulted with some leading minds in this epidemic, in this aspect, and so we will continue to work closely together with the international organizations to secure the final victory against COVID-19. All right, thank you very much to our two ministers. And now we're going to enter the Q&A session. And before you ask the question, you need to introduce yourselves. All right, the female journalist in the second row. Thank you very much. I'm from Red Star News. So we are already in winter, facing potential epidemic risks. So what are the measures or advices that you have in protecting against the risk in key places? So this is a very important question, and I will take your question. So people of all age groups are prone to the coronavirus pandemic, and so we have to do a good job as an individual, as a family, and also as a community. So it's important for each and every one of us in terms of epidemic control measures and methodologies. I would like to brief the following. So first, we are already in winter. With the drop of the temperature, people tend to spend a lot more time indoors than outdoors. We have a increasing likelihood of crowding indoors, and also the likelihood of cluster infection is also growing. And so we have to guarantee ventilation in other places of the country, in particularly in the north. And in the meantime, we have to step up our medical supplies. So we have to keep a clean environment, in particularly in those public places, for example, stairways and elevators, door handles, and those places have to be sanitized regularly. Workers and personnel in key categories have to do a very good job. For example, salesmen, cleaners, food delivery men, and staff working at public transportation hubs. They have to do a very good job in keeping personal sanitation, for example, wearing masks, washing hands, and keeping social distances. For the general public, it's very important to do a good job in preventing the disease, and the public should cultivate the habit of washing hands regularly. And when you sneeze, use your elbow to cover it. And we have to develop the habit of wearing masks for senior citizens, children, pregnant women. We have to step up our sanitation measures, and these groups of people should reduce their outdoor activities and avoid entering indoor places with very bad ventilation conditions. In the winter, we have to focus primarily on prevention. Those personal prevention practices which were well developed over the year have to be continued, and we have to stick closely to those very good habits and practices. Next question, please. The female journalist in the third row, please. I'm from a China Media Group. As Minister Li Bin has mentioned that there is increasing risks of imported cases. In recent weeks, the virus was detected in packages of food products, and there is an increasing risk. And I would like to ask, what are the measures that we have put into place to guard against this particular risk, and what are the measures that were already put in place? Well, let me answer this question, and thank you very much for your question. So this is a very fitting and very good question. There is a lot of attention to this question to effectively protect the public against the imported cases. The General Administration of Customs have stepped up our effort in inspecting imported food. We focus primarily on the sources and origins of this food, and we are working closely together with relevant exporting countries, and we encourage these countries to follow the regulations of FAO and WHO, and we also press food exporters to follow those guidelines and regulations, both in terms of production, packaging, warehousing, and transportation. We also shared with those enterprises the guidelines on preventing COVID-19 in the food supply chain published by the National Health Commission of China, and we require those enterprises to put in place relevant measures in order to guarantee that those measures are put into practice. We have in place a distance surveillance system. So we have a distance video inspection, and up until present, we are working closely together with relevant authorities in more than 109 countries, and we have organized, for example, more than 180 video conferences, and the proposals and suggestions of the Chinese government have been well responded by most of those countries. And today's day, we have conducted 140. We have conducted inspections in 140 enterprises from 50 countries, and for 20 of these enterprises where a problem was identified, we removed their export licenses. Secondly, we have suspended the export license of enterprises that are in trouble, enterprises that have reported a cluster infection as of yesterday. For 99 enterprises from 20 countries with a positive cases of employees, they have accepted our proposals, and 20 enterprises among these have taken the initiative to suspend their export to China. And third, we have stepped up inspection and sampling on imported food. We have focused our attention particularly on imported seafood, and as of yesterday, the General Administration of Customs have taken samplings from 870,000 pieces of imported food, and most of these have a negative result. And wherever there is a positive result, we take immediate measures. Where a positive case is identified, the General Administration of Customs will suspend the application of imports for that enterprise for one week. So as of yesterday, the GAC has taken preventive measures against 6 ships, and the GAC will earnestly follow the guidelines of President Xi Jinping and do a good job in tracing the origins and preventing the COVID-19 virus, and follow the guidelines issued by the Joint Prevention and Control Mechanism of the State Council, and we will do a good job in preventing the COVID-19 in major parts of international trade. Thank you very much. Thank you very much for your question, and let me just add a few words from the State Administration for Market Regulation. In order to implement the guidelines made by the State Council Joint Prevention and Control Mechanism, and also the guidelines made by CPC Central Committee, the State Administration for Market Regulation will strengthen our efforts in inspecting imported food. Number one, we are going to work closely together with relevant departments such as the GAC and also the National Health Commission. Our joint efforts will cover all the imported food. This includes the process of production and also the sanitation and disinfectants procedures of relevant import enterprises. And we will also work closely together with different localities to regularly carry out inspections over freezing warehouses, agricultural markets, and our efforts will mainly focus on the inspection of imported food. And we will increase our efforts in regular inspection according to the guideline of the Joint Prevention and Control Mechanism of the State Council. The State Administration for Market Regulation will guide relevant localities to actively guide the different localities in handling positive cases. As for some of the positive cases that we have identified in recent weeks, we have organized virus tracing and coordinated cross-province information sharing, and stepped up the management on virus tracing. In so doing, we have dramatically reduced the risk. Third, we put in place an accountability mechanism, and the State Administration for Market Regulation will put in place an accountability system. And according to relevant laws and regulations, we are going to strengthen our efforts in quarantine and inspection on imported food. And this covers the energy system, the origin system, and also the production procedures. For food whose origin is not clearly indicated, we will step up our regulation. And in the meantime, we encourage food importers to look into the food inspection report of the exporters, and also to claim the disinfectants report. And where these reports are not obtained, the food is not allowed to be sold on the market. Next question, please. Thank you very much. I'm with China Daily. The virus is taking another swipe in overseas countries, and total confirmed cases have exceeded 50 million. A lot of the countries are having a second wave. And winter is a season for infectious diseases, in particular respiratory diseases. And so we are faced with very arduous challenges. So what are the measures that you have to do a better job in preventing the disease from coming in from overseas? Thank you very much. Since the outbreak of the pandemic, the General Administration of Customs have stood at the forefront of the efforts in preventing the virus from coming into this country, and entering winter, we will step up our efforts. Our efforts will cover inbound travelers, and at those airports we have temperature measurements for twice, and we also do a good job in information sharing, and under the guidance of the Joint Prevention and Control Mechanism, we have in place a closed-loop management. We are consolidating the defense line of epidemic control. In the meantime, we are increasing our capacity. In September, we have organized 42 subordinate organizations here domestically. In emergency drills and exercises, we have dramatically improved their capacity. And in October, we carried out a self-inspection within the system of customs. And we never slacken our efforts, and facing severe challenges in the coming winter, we will take even better policies, and we will be persistent with our efforts, and we will do a very good job in preventing the disease from coming from overseas. And number one, we're going to strengthen risk warning by improving the monitoring and reporting mechanism and the communication mechanism with other countries. We are going to put into best application our big data technology. We will scientifically look into the epidemic information, improve our emergency policies so as to achieve early reporting, early discovery, and also early treatment. Second, we're going to strengthen our effort in inspecting inbound travelers. We require a full process NAT, and for inbound flights from high-risk countries, we require due tests. And third, we prevent not just COVID-19 but also other potential infectious diseases, for example, infectious flu and also other respiratory diseases. Third, we are improving our inspection capacities, and for the pressure due to the pressure of increased flights, we will dramatically improve our inspection capacity, and we will put into place a fast mechanism of checks and inspections at the ports. And the General Administration of Customs will play a supportive role to ensure the speedy and efficient inspections. Number four, we're going to strengthen collaboration under the framework of Joint Prevention and Control Mechanism. We will share information with relevant authorities. For all the inbound travelers, they will be tested and inspected, and the whole process will be jointly coordinated and carried out through our cooperation with relevant authorities. And we do so to reduce the risk from the origin, from the very source of the danger. And we would like to give a warm reminder that for inbound travelers and people coming back to the country, they need to pay particular attention to personal protection along the journey and wash their hands regularly. And if you have difficulties in breathing, and if you have a dry cough, and you will have to work closely with the General Administration of Customs in NAT and also in other relevant inspections. So Mr. Bi Kexin just shared our measures at the forefront. Well, let me talk a little bit about our efforts in overseas countries. So this is the measures at a distant place far away from the country, and so entering into winter, we have more risks. And today's day, we have conducted tests for 400,000 people, and we have identified 30,000 positive cases. So in overseas, out of 400,000 reports, we found and we kept off roughly 30,000 potential cases. So this is a very important effort. So that is to say, roughly 30% of all the incoming travelers could be dangerous. And NAT is one integral part of our efforts, and it has very high accuracy rate. In spite of all these efforts, we still have 3,600 inbound travelers after landing in China. They have been confirmed as a positive case. So this tells you that no matter what measure we put into place, it cannot guarantee 100% accuracy. So that is why we are working together with National Health Commission and relevant experts. After full deliberation, we believe it is very important to put in place a second protection layer. So that is why we are practicing the antibody test. So this is like a second layer of protection, and after put into practice, it will more effectively ensure a success in preventing the disease from overseas countries. So those measures are taken on a basis of full deliberation and consultation with experts, but that does not mean that we are not taking into consideration the actual situations of different countries. For example, our embassy in New Zealand has released a notice that when they actually face difficulties in antibody test, so they are replacing that antibody test with another nucleic acid test. So this practice is also put into place in other countries facing the similar difficulties, and all these measures can improve the reliability of those tests. For transfer stations, we know that international travelers transferring at a third place are exposed to higher risks, and after the consultation with experts, we have found out that among these 3,600 imported cases, in particular after October, more than half of them were infected with the disease after transferring from a third place. So that is why we put in place the due test measure in the airport of transfer. So that does not mean that we are not taking into consideration the actual needs of relevant countries. So we do all this to step up our protection on all the travelers. So these are some of the specific arrangements that we have made. For example, some of the major aviation hubs, they already have the capacity of practicing due tests. If they could do that, they would just practice this measure. If the airport does not have the capacity to do that, then you can dial the hotline of 12308, and our diplomatic staff will stand by around the clock, responding to your needs and calls. international travelers and overseas Chinese. Should you encounter any difficulty, you can dial the hotline, and our diplomatic staff and staff at the embassy will work closely together to respond to your needs. Do we have any response from the National Immigration Administration? I would like to add a few words on that. Stepping up prevention at major ports is one integral part of this very important effort. So the National Immigration Administration is a key part in this very important effort, and we have made important contribution to prevention of the disease from overseas. We have to, at some of the process, we have to allow the travelers to just put off their mask. So that means that our own staff are exposed to risks. So we are not going to just protect our own people, but also protect all the inbound travelers. And according to the changing situation of the coronavirus pandemic, the National Immigration Administration is faithfully implementing the guidelines of the Joint Prevention and Control Mechanism, and virus prevention is the key part of our work. As we enter winter, we will continue to strengthen our measures, and these measures can be reflected in the following 4 areas. Number 1, we're going to strengthen the control and regulation in ports. Since the outbreak, we have closed 46 land ports and 66 ports channels. At the same time, we have stepped up control and management to guard against potential trespassing of overseas Chinese or inbound travelers. We only returned the cargo function of those ports, and we have suspended the function for personnel flows. And second, we have reduced unnecessary flows of personnel. As Minister Gao has mentioned, we have prudently adjusted the policies on inbound travelers. And for the National Immigration Administration, we have temporarily suspended the inbound travel of foreigners with certain types of visa, and we also have tightened the policy of visa-free. And we also tightened the policies on visa and documents application. We do so to reduce the unnecessary visits that are happening cross-border. And here I would like to specifically thank the Chinese people for their staunch support. And since the outbreak of the pandemic, they are able to abide by the regulation requirements of the central government, and they are also able to conscientiously follow the reminders issued by different departments. So because of your support, we have had a very stable and steady operation of these ports. Number 3, we are strengthening management and supervision on cross-border vehicles. So this is a very important part of our efforts, and there is a lot of attention paid to that. At the very beginning stage, we established a joint mechanism featuring the collaboration between party, government, the military, enterprises, as well as the people. And we are closely following the developments of the virus overseas, and we are scrutinizing the loopholes of port management and streamlining our management procedures. We do not reduce our dedication to this effort, and we will never slacken our efforts. On top of that, we have extended the number of potential checkpoints for personnel coming in and out of the border. We have strengthened the supervision and inspection over their vehicles, and we do so to keep off potential cases and viruses. Number 4, we have strengthened our effort fighting illegal activities of trespassing borders, and a lot of those travels are criminal acts. Some of the citizens are crossing a border to engage in illegal immigration, gambling. So since the beginning of this year, we have identified more than 700 smuggling cases. We have identified more than 5,000 illegal entries. So we have kept off these people, and which effectively avoided the illegal entry of relevant personnel, and in so doing, we have kept off the virus at our border. So in general, the National Immigration Administration is playing our part under the leadership of the Joint Prevention and Control Mechanism of the State Council. We are doing a very good job in keeping up the virus. Thank you very much. Next question, please. Writers, please. I'm with writers. Can I ask my question in English?
China consider closing its borders to travelers from more countries this winter and creating a closed-loop travel bubble or travel bubbles with countries that have few or no new cases? If so, which countries, when, and what will be the conditions for this? Also, second question, will China consider receiving and treating patients who have COVID-19 from other countries this winter if hospitals in other countries exceed their capacity?
好，请翻译一下。
我有两个问题。第一个问题是，随着冬季的到来，中国是否会考虑
Now the question is being translated into Chinese.
边境，同时也考虑同那些几乎没有新病例的国家形成闭环的旅游气泡。那么第二个问题，那就是如果有一些别的国家，他们的医院的承载能力超过这些国家的承受的范围的话，中国是不是会考虑接受并且救治别的国家的新冠疫情的患者？谢谢。
罗部长，
我来回答。
先说。
好，非常谢谢你这个问题。
Thank you very much for your question. So we don't have a yes or no answer for all the different proposals given to us. You talked about this travel bubble. Well, because recently Singapore has announced some measures to open some flights with other countries. I've also taken note of the fact that they have reached the travel bubble arrangement with Hong Kong. So at a time when the pandemic was not at its worst moment, the Chinese government was considering establishing convenient channels, green channels, to recover the flow of personnel across different borders under the current circumstances. As you might know, that we had a lot of domestic travels, in particular during the National Day holiday, and for international travel, I think we need to be cautious. And we do not support relaxing the control on international travels. So this is the opinion that I have learned from relevant departments. But we are working closely together with Asian countries in opening more green channels and convenient channels. We can have very smooth online communications, and but I do not think that I do not think that the conditions are mature for arranging travel bubble arrangement with those countries. And for the second part of your question, so will the National Health Commission practice China's international obligation in international humanitarian assistance? Well, I can tell you there is no problem on that. The pandemic is still raging in a lot of places of the world, and so we are closely studying the situation, and we will make some final arrangements. But if I don't remember wrong, there is some regulation of WHO, and if you are a potential case, you're not allowed to travel to other places for treatment, and you have to seek treatment in your own local place. So that is why we are considering of dispatching some of our experts and medical personnel to different localities and different regions, and we can also provide some equipment and medical supplies, and also share with the other countries our experience with respect to makeshift hospitals. For example, in Myanmar, we helped them build the first NAT equipment, and we also provided this equipment to Laos. And as for ventilators, we are also working closely together with a huge number of countries. So we are providing a huge quantity of such supplies. So thank you very much for your question. It's a very professional one. Next question, please. Thank you very much. I'm from Hong Kong. So winter is a very important season for Patriotic Public Health Campaign. And what specific plans do you have in this upcoming winter, and how do you combine the efforts fighting infectious flu and COVID-19? Well, let me answer your question. When I was making the briefing, I also shared something about Patriotic Public Health Campaign, and now let's share with you a little bit about how that is related to epidemic control in the winter, and I will go a little bit in detail. During the pandemic, President Xi Jinping has made a number of important guidances on Patriotic Public Health Campaign, and Premier Li Keqiang said that we need to align the Patriotic Public Health Campaign with our efforts in fighting infectious flus in winter and also the COVID-19. So we have mainly engaged in the following 3 areas of efforts. What is closely relevant to epidemic control is that we have recently released a notice which is about carrying out patriotic public health campaigns and combining our efforts fighting infectious flu and also COVID-19. So this notice requires different localities to clean up their environment and to engage in publicity efforts in public health campaigns and to improve our capacity fighting diseases and also cultivating healthy lifestyle. In so doing, we can reduce the dangers of infection. So this is the efforts carried out by the government, and as you might know, that the Patriotic Public Health Campaign is a mass campaign. So we have to mobilize the whole society, encourage the government, individuals, and the society to play their part, to also leverage the platform of Patriotic Public Health Campaign, and social organizations and civil societies have to mobilize different groups of people to be part of this campaign and to prevent potential disease. From the perspective of individuals, as I have shared earlier, that each person is the first responsible person for his own health, and we need to cultivate a civilized and healthy lifestyle so that we can consolidate the defense line in epidemic control. And here, I'd like to take this opportunity to ask all the media sitting here to support us and work with us in this public health campaign so that we can jointly form a social atmosphere in supporting public health campaigns. At present, we will have to align the campaign with epidemic control in winter and strengthen our efforts in winter. When I say prevention, it's not just the COVID-19, but also other infectious diseases. And so that's all I have to say about this. Thank you very much. Next question, please. Phoenix. And with Phoenix, you all mentioned that there is a second wave in overseas countries. And so what is your advice for Chinese who plan to travel overseas in this upcoming winter? So what is your question again? All right. So as I have shared earlier, the Ministry of Culture and Tourism has released a notice not long ago, not advising people to travel overseas in this upcoming winter. So the policy is clear-cut. If you have to make an international trip, you will have to protect yourself and also gain full knowledge about the epidemic control knowledge of the destination country. It is highly recommended that you prepare yourself for potential uncertainties. There are some similarities in the policies of different airports, but still I would like to say that avoid going out in this upcoming winter, and if you have to go out to other countries in this winter, you will have to learn the policies of your destination country and also the policies of a transfer airport. And once you are outside the country, you will have to abide by their laws and regulations and their measures in epidemic control. But should you encounter any difficulties, our embassy will stand by and provide you some assistance. But still, for some of the issues, the embassy will not be able to make some assistance. For example, there are 14-day quarantine policies, and for that you will have to isolate yourself for 14 days. Even in the United States, different states may have different measures. And if you are from New York and if you travel to other states, you may be quarantined for 14 days. And if you are from other countries and traveling to New York City, you will have to isolate yourself for 14 days. So you need to learn those knowledge before you make the trip. Well, let me quickly add a few points. The National Immigration Administration is in charge of approving the applications for travel documents and visas and papers. So as I have mentioned earlier, we will regulate the activities of international travel, and Mr. Luo has well mentioned a lot of those details. And let me quickly add a few points. I would like to give a very serious reminder that when you do international travel, have in your mind your personal safety and the safety of your family, and try to avoid unnecessary international trips. And you need to pay close attention to the following factors. Number one, if you travel overseas, you face a higher risk of getting infected. So the risk is very high overseas, and you have to be prepared for these potential risks. So you have to follow the developments of the virus in relevant countries. Number two, recently, some countries have adopted policies of quarantine and isolation for inbound travelers, and you need to be aware of those information, as Mr. Luo has well mentioned a while ago. And because we have cases, for example, when our citizens travel to a third country, they stopped at the border, and they are also isolated and put into quarantine. A lot of economic loss was caused. So number three, if you travel to overseas and once you get infected with the disease, you will have to, for example, treat the disease. That may entail a lot of costs and a lot of inconveniences. And number four, there is only a limited number of international flights. So we face a lot of uncertainties when it comes to international travel, and there's no one that can guarantee the smooth travel of your trip. And number five, according to the policies here, inbound travelers will have to be quarantined at the city they land, and they will have to pay for their own cost during the quarantine. So there is a lot of economic cost and also time cost. So that is why I sincerely advise all the Chinese citizens to reduce or avoid unnecessary cross-border travels and international travels. So avoid going out at a time of danger. Thank you very much. Well, due to time constraints, our last question, please. Thank you very much. I'm with China Media Group. So vaccine is the strongest weapon, and according to media reports, some Koreans, after vaccinated, some symptoms occurred, and there are even reports of deaths. So tell us something about the vaccine. Thank you very much for your question. So the death report of the Korean after vaccination went viral on the media. We are closely following the situation, and they haven't disclosed some information, but we are still tracking these incidents. And here in China, if we talk about the categorization of vaccines, so infectious flu has a category 2 vaccine, which means that the vaccination is conducted on a voluntary basis, and we are working closely together with relevant departments, for example, the Ministry of Information and Technology. A number of ministries have worked in close consultation. We dramatically improved our productivity in vaccines. Compared to last year, the productivity increased by 1-fold. And the productivity of vaccine this year is the highest in 5 years. And there is a growing demand of the vaccine recently among the public. So in light of such situation, in order to work closely, in light of this situation, we have worked closely together with the National Drug Administration and Ministry of Information and Technology, and in the process of vaccination, we have planned some measures. For example, we increased the vaccination points, and we moved the time of vaccination earlier, and people who want to get vaccinated have to reserve in advance. We expanded also the working hours of each vaccination day, and we did all this to provide convenient services to all the people in a society. So in China, the vaccination time is adjusted according to the different time arrangements, and currently the effort is spread from north to south, and as of November the 9th, nationwide, we have 2.5 million vaccination for infectious flus, and this is already equivalent to the total scale the same period last year. So this is only for infectious disease, and this is only for infectious flu. And as I have mentioned, each and every one of us have to pay particular attention to personal protection. Prevention is very important. We have to wear masks. We have to wash our hands very often. Do not rub your eyes and nose or mouth if the hands are not washed. Entering winter, we will have to ensure frequent and regular ventilation at our homes. And also, we have to maintain a safe social distancing in closed indoor spaces. This is very important. We have to avoid entering closed spaces, and when we do, we have to protect ourselves with the masks and with social distancing. And also avoid getting to places with a crowd. So we need to avoid those places, and these measures have been proven very effective. Thank you very much. Thank you very much. Thank you very much to all the speakers and to all the journalists.